Hello, everyone. Dr. Christine Smith back for a really interesting interview for you today with Dr. Ryan Bentley, who is a MD, DC, PhD, and is one of the smartest people I have had the pleasure of meeting. And we wanted to talk about the mind-body approach to your health, everything from your gut health to your mind to your energetic health. And I think And if we can understand how these all interrelate, it makes a huge difference for pretty much every kind of health condition, no matter what we're talking about. So I'm so excited to have him on today. Hello, Dr. Bentley. How are you?
Can't hear anything.
Oh, you can't hear me? Shoot. Let's see. We can try connecting one more time and I can just start this over, but hopefully you should be able to hear something.
Oh, now I can hear you.
Great. Okay. Fantastic. Hi, Dr. Bentley. How are you? Thank you for joining me today.
Hey, thank you. I'm doing great. How are you doing today?
I am good. Thank you. I was just telling everybody a little bit about what we were going to talk about. Then I was just going to tell them a bit about you because and maybe I'll just let you dive right into it, but I think you have the most interesting background. And I also know that you've written a couple different books. And so I'd love if you could tell people about your books as well. But yeah, if you could just tell us a little bit about your journey and integrating 3 different doctorates and what that was like and just what you came to understand through that experience.
Yeah, well, it's definitely a journey that I never thought I would take, in all honesty. And I think probably half the people that I went to high school with are like, what? Bentley, what? So anyways, it was a very interesting journey. So I initially planned on going into medicine and had an injury in my low back from playing football, and then ultimately deviated paths and went into chiropractic for a number of different reasons. And along that path, I practiced for about 8 years. Had a control alt delete on my life when a good friend of mine passed away and left 3 kids behind. And I realized, having my home and just supporting the family wasn't being a dad. It wasn't being a husband, because I was gone all the time and I was missing some of those precious moments of their lives. So sold my home, sold my practice, and moved to Michigan, another place I said I would never live. And actually a wonderful place to raise my family. And in that path, I lectured around the country and I was in control of my schedule. And in that path, I had written a book called Sexualizing Cholesterol, and just talking about cholesterol as a component of heart disease, but it's no different than having 1,000 acres of trees or 100 acres of trees. You don't cut down the trees to prevent the forest fire. And, cholesterol, yes, it's just you have a bigger forest fire, but again, it's not the cause. And so I won't get into that. But anyways, I was lecturing and met a dean of a medical school that was like, you need your MD and a PhD. I was like, not a chance. I'm not going back to school. And then after, I don't know, about 7 months later, after praying about it and a number of other God moments, we met as a family and we made the decision that I was to go back to school. So off I went back to school at the ripe age of 36. And yeah, so did my MD, finished all that in December of 15, and then finished up PhD work in 16. And somewhere in between there, wrote a book called Vessels That Thrive, Choosing a Lifestyle of Health, Healing, and Faith. Getting people to realize that we all have a purpose and living that purpose is very important, but you could do it better and be used better if you're more healthy, having the energy and the capabilities to do the things with the gifts and skills that you have. We all have different gifts and skills and can influence other people. So that was my main book that had come out, and then just wrote a book that is currently in editing right now. I just got the first 3 chapters back that I'll be reviewing today. It's called Living Your Why, A Journey Towards Purposeful Health. And oftentimes people know what eating healthy looks like. I mean, I go talk to a 3rd grade class and we have a table of junk food and a table of healthy food. They all know which one's healthy. It's not rocket science. We all know that exercise is really good for you. It's the reasons why we choose to go the other way. Why do we continue to go down and make the choices that we know aren't beneficial for us? And realizing that we have a circle of influence that honestly need us with each of our gifts and skills. And we all have a circle of influence and we all have different skill sets that we have. And so it's been a very interesting journey in that pathway, because I got 2 trainings that are dichotomies. One, medicine, which is focused on sickness, disease, and pathology. And then I've got chiropractic that's focused on health, wellness, lifestyle, vitality, the unlimited healing capability of the body, versus medicine, where we have this finite definition of what we can and can't do. So it's really this true dichotomy that I try to integrate with my patients, that I get to serve in a way that encompasses the whole spectrum. Because again, it's, if you're not healthy and well, but you're not sick and diseased, a lot of times we just say it's in your head. But it's this in between land of where people are, it's years of dysfunction that lead to disease and pathology. People don't wake up one day and have type 2 diabetes. You don't wake up one day and just have heart disease. These are progressions, and it's that years of dysfunction. So honestly, it's trying to identify where those dysfunctions are before they become pathology, and help turn that back towards the arrow towards health and wellness as we continue to age. Because we can't anti-age. We're all going to age. It's just, can you age gracefully and powerfully? You know, and that's the key thing. And so I really try to help bring about all the disciplines, and also stay on top of some of the latest and greatest research, to help people facilitate healing when their body is weakened and at a state that it can't really recover the way that it needs to.
That was such a beautiful explanation of the different mindset approaches, because I think that's one of the things that comes with those degrees is, yeah, it's this whole other perception that you're studying the same things from. So you're seeing it from all these different angles. And I like what you said at the end, where it's like when someone's body has gotten to the point where it's not recovering like it's supposed to. I would love to kind of dive into that more, and some of the things that you see as like foundational health principles that guide your practice and affect things like our energy and our metabolism. And then I know you've also, like, as part of your PhD, you did research in photobiomodulation, which I find fascinating, but I think a lot of people don't even know about. So I'd love if you could, yeah, just share a little bit about your kind of foundational principles, how you apply it in your practice, and how things in research like that color your perception of things.
Okay. Yeah. So, how long do we have? Just joking. So looking at it foundationally, when someone comes in, I'm assessing them to find out, do I need to play fireman or do I need to play handyman? Because it's a different set of tools,
Yeah.
you know? And so I'm trying to assess what critical level they're at. Or is this someone coming in with stage 4 cancer? Is this someone coming in with massive anemia that their hemoglobin's at a 3? What's going on here? And do I need to send them out to get them stable and then have them come back? Or is this someone that just feels blah and they don't feel well, but they're not a pathology and no one knows what's going on? And how do I stratify that? So when it comes to the principles, I mean, it's a lot of chronic diseases that we deal with is our body interacting with our environment. And that environment includes what we put into our mouth, what we intake into our ears, what we're thinking about, what we're listening to, what we're watching. All those things have principles, and our level of activity. So from the thoughts you think to the foods you eat to the exercise that you do or do not get, it's all about a deficiency and toxicity, you know. And you can think about the mindset. If you're constantly in the state of fear, then you're constantly driving your sympathetic nervous system, which never gives it that time to recover. And so, but that changes your biochemistry. So I look at it and I go, look, if you're driving down a highway and you see a cop car and you know you're speeding, your heart rate goes up, your blood pressure goes up, your muscles tense up, you're not sick. You adapted to a thought process of fear. So a thought created a chemical change that led to a physical manifestation of symptomatology in your body. But it's the chronicity of it over time. And so I ultimately think about going back to the very beginning. And so in the beginning, let's just go at the point of conception. So the moment the sperm hits the egg, there's what's called the zinc spark. That zinc spark is a flash of light. If you look at it, and it's depolarization of calcium going across the cell membrane when you look at it underneath the microscope. It's phenomenal to witness this. But energy, and so that's a form of energy, and that's when we become this self-healing, self-regulating system that becomes what we are today. But it's at that moment that there's energy. So when you look at the body's resiliency, the body's ability to adapt to our environment. So when we're young, our body adapts very easily. But you start to notice when you become a young adult, you're not exercising like you were, but you're still eating the junk food that you had, all the treats going from all your games and fast food and different things. You start to notice your body starts changing. You're getting fatigued more. You've had years of this, but now you've changed the variable. Less exercise. You're sitting at a desk all day long. You're not playing 3 sports like it was when I was growing up. That was the norm. And you're not eating. You're in charge of your food, but we're inundated with the food sources of high calorie, nutrient deficient foods, such as a pizza. I'm sorry, tomato sauce does not count as a vegetable serving in my opinion, but it's looking at it from that aspect on everything from the physical, chemical, emotional aspect, all the way down to the level of cell. It's about energy. And so in my practice, I do a lot of things when it comes to energy metabolism and how do I help the body get from this state of deficiency now where they can't overcome the environmental stressors, whatever that may be, whether it's too much junk food into their mouth, whether it's mycotoxins into their body. There's so many different things that lead to this. And so it's really trying to assess that. And so some of the modalities that I use is photobiomodulation. So photo for light, bio for the body, and modulation is to modulate it, to enhance it in most cases. So when you look at most people, when they go out on a beach, they feel great. They're getting negative ions from the ground because they're grounding. That's a whole separate topic in of itself. They're in sunlight and actually getting light. In our body, we're like a plant. I mean, plant makes energy from sunlight, and we do that as well. And some of the things that I had learned through going through photobiomodulation, and I was doing on whole blood using UVC and UVB with Dr. Einstein, and looking at how the body, how there were certain adjustments. And I was able to see, 125 hydroxy vitamin D levels increase in people going through these treatments of the whole blood, where it's activating your 25 to 125. I would see people's hemoglobin A1C level, which is, for the listeners that don't know, hemoglobin A1C is what we call glycated red blood cells, which is kind of the process of glycation is the crusting of bread. If you take dough and you throw it in the oven, you don't do anything different to the outside. It's just exposed to the heat, and then that heat causes protein and sugar to bind that creates your crust. So think of your red blood cells that are supposed to carry oxygen, which helps your body get energy, and you have high levels of sugar in your blood. Your A1C, your red blood cells become glycated, crusted over, if you will. And we are able to see conformational change of the hemoglobin structure, almost busting that crust off the red blood cells, which would allow the increased oxygenation at the cellular level, which was pretty cool to be able to see that and extrapolate that. And then also that energy, we were able to see that the UV light gets absorbed because our hemoglobin inside of our red blood cells it carries oxygen, but it would absorb that light energy and carry that around the body for up to 3 days. So again, energy never dies, it just changes form, right? So this gives us an ability to add energy from an external source to help raise that person's resiliency for a level of time. And so I use light energy to help with that through red light therapies and UV light. We have what's called EBU full spectrum, which adds oxygenation and ozone to the body. We have hard chamber oxygen chambers in our office where we do hyperbaric oxygen at 100% oxygen concentration under pressure, just to help the body be able to heal. And that's where we've been able to see people with non-healing wounds because they got poor blood flow start to heal, where they've had wounds for 14 years that were down to the bone that are now completely covered up. People that have had wounds that they haven't been able to swim in a pool because they had an open wound for over 4 years to close up after 16 sessions. Just phenomenal things. But are we meant to have go into hyperbaric oxygen chamber all the time? No, it's when your body's in a deficit that you can't overcome. You've lost your resiliency, your ability to overcome and adapt to environmental stressors now because the chronicity of it from a physical, chemical, emotional level, that we have to raise the body to a new level. And we do that with different modalities to help the body heal. But I try to go back to the most simplest level of physiology, which is all about ATP, because without energy, our body can't heal. So how do I help that ATP, which is our energy currency? So when people are at a deficit, their savings account, they're bankrupt, and they're no longer even living paycheck to paycheck. They're borrowing. And that's when they start to lose their muscle mass and symptoms start to manifest because their body's just doing everything it can to stay alive and stay vibrant. But it's lost that vibrancy. You're at a state of deficit. So we're trying to build that savings account back up and help that body heal. So that was very long, and I apologize.
No, that was amazing. And I love everything that you brought up. And I think I like talking about this stuff because I feel like so many people have never heard of it or they're completely unaware that it's available to them. And so I love these concepts because it teaches people questions they can ask or things they can look for or practitioners they can seek, especially if they've been dealing with something for a while. And I really liked how you're talking about hyperbaric chamber in addition to the light spectrum stuff. So again, like just to recap for anybody listening, he's talking about using different light frequencies to basically provide your body with energy that it can redistribute or to help your cellular health clear debris. And then there's really interesting things about like hyperbaric chamber, like epigenetic effects that it can have, which, you know, stress and trauma and infection can also have those effects on the body. Any like thoughts you want to add in the realm of just like epigenetic changes with these
Yeah.
approaches?
Yeah, absolutely. So in the hyperbaric oxygen chambers, they've actually done studies showing that oxygen under pressure tones down the inflammatory genes that are being turned on and turns on the anti-inflammatory genes and will start to stimulate some of the transcription, which is the reading of your genetic code of the things that help facilitate healing to help rebuild in that way. And so you could totally see these transcription factors occurring. And so the research is there. But again, there's nothing more simple than oxygen under pressure. It's the first thing we do when we take our breath of life is take that breath of oxygen. It's the last thing that we do, you know, but we put it under pressure to saturate areas that may only have 3% oxygenation. And we can saturate the tissues. They did a study where they took, I believe it was guinea pigs, might've been regular pigs, took out all the blood and just put saline in and then put them in hyperbaric chambers and they stayed alive because the oxygen under pressure, but it kept their mitochondria working, making energy. So they were able to stay alive. It's mind blowing. And there's over 110 different indications worldwide, but in the United States, with the FDA, insurance companies only cover 14. And those are like, you know, catastrophic things like carbon monoxide poisoning. So you could see someone going in completely intubated on life support and walk out of the chamber because it's displacing that carbon monoxide on the red blood cell. So they now can get oxygen delivered back to your cells. Because again, without oxygen, you can't make ATP. Without ATP, you're dead. Cyanide poisoning is another one. So cyanide blocks your mitochondria from making ATP. Well, with hyperbaric oxygen, you can bypass that. Methylene blue is something that can be helpful for that. Methylene blue is part of photobiomodulation. So that's a whole nother separate topic on methylene blue that we don't need to go into because that would be a whole nother conversation, you know.
Yep. Oh man, you and I could talk for days, but yes, I like your awareness of everything. So with like these oxygen-based therapies, I know you also do some other ones in your clinic, things like ozone. And you know, and for anyone listening, if you have questions that you want to know afterwards, like this will be posted on the feed, just comment afterwards and we'll try to answer your questions. And we can always do another one if you're interested in other topics. But for the clinic, I know you also use something called like EBU, which is basically extracorporeal. Remind me what the acronym stands for, but it's ozone.
Extracorporeal blood oxygenation and ozonation. Yeah.
So basically, it's where you are moving the blood in the body through a filter and adding ozone to help the body separate toxins out in the blood. But I'd love if you could talk about it from your perspective and like the results that you've seen and how it works and patient outcomes and all of that.
Yeah. So in the most simplest term, I think about it as an oil change. And some people are familiar with dialysis. So some people will call it ozone dialysis. But you have one line coming out of your arm and then it goes through there's a dialysis pump and it'll go in through a dialysis filter that's acting as a diffuser of oxygen and ozone. Ozone, when it touches biological tissue, is no longer ozone. It becomes oxygen because it will, when it touches biological tissue, it loses that free radical and it stimulates anti-inflammatory pathways in the body, increasing your own antioxidant capacity. it also will destroy viruses, bacteria, and things of that nature inside in the blood if it's circulating around. Can neutralize mold toxins and things of that nature. And then there's a drip chamber over on the side that is definitely some proteins, and some studies have shown inflammatory proteins. I think they're still stratifying all the things that get filtered out from that aspect of it. Then it goes back up and it goes through the photobiomodulation of full spectrum light in addition to UVA, UVB, and UVC light, which also, you know, if you remember back, we had a pandemic recently, if you don't remember, and some people would sterilize things with UV light. And that UV light ultimately does create a layer of ozone as well, which is another mechanism with regards to photobiomodulation, how that can be helpful to increase oxygenation as well. And then the blood goes back into your body. So I use that often in some of my most critically ill patients, and then some people that just really want to have peak performance. I do it about once a quarter, and the rest of my team, we try to do it about once a quarter just to optimize ourselves and do the best we can. And so some people with sick building syndrome or mycotoxicity, where they've got black mold in their home and they don't know it, and they've got a multitude of symptoms, chronic, you know, and when I say chronic fatigue, I think of that as basically the body's lost its resiliency and it has low energy state and it can't overcome healing, and they constantly feel miserable, and people just tell them just to work out, but they don't have the energy to go work out. So how do we help them with that? So this is helping all the way to the cellular level, because the EBU also will increase your oxygenation of your blood, and which you can see very clearly of the blood coming out being deoxygenated and going back in, basically kind of a dark maroon and being nice and bright red, what you see on the color spectrum going back into the body. People with chronic Lyme disease have responded very well. Just received some text messages recently of a person that comes to our office that had been struggling with chronic Lyme disease for over 5 years. And this particular person, after the second EBU treatment, she had already been on antibiotics for 2 years and 9 months, 3 different ones every day, which we know that's destroying the microbiome. And after the second treatment, her Lyme specialist pulled her off all the antibiotics, did very well, had some life crisis things that happened that threw her body back into a whirlwind, because as we were building that resiliency, all of a sudden significant emotional traumas came and knocked back down. At that point, we moved into our new office and had the hyperbaric oxygen therapies. And I just received text images and stuff of she's read a book for the first time on a plane ride after 5 years not reading a book. Did some hiking, was able to go to a beach and go on a 2-week-long vacation and not feel like a debilitated person. And just pretty heartwarming to see someone that struggled so bad for 5 years just by using some of the modalities all the way down at the cellular level. And the cool thing about people don't recognize, like with Lyme disease, is when it gets into the nooks and crannies, it's what we call a facultative anaerobe. It doesn't like oxygen. So it goes to these nooks and crannies into the body, into your joints, because there's not great blood supply in your joints. And all the areas where you don't have this great oxygenation. So somewhere, an area that you may have chronic low-grade inflammation has decreased oxygenation too. So taking an antibiotic, even if you're doing that and there's not great blood supply, it's going to be really hard to penetrate and get it to that area to facilitate knocking that spirochete out. But now you put it, it's again, an anaerobe, facultative anaerobe doesn't like oxygen. So now we put them in hyperbaric oxygen. We're saturating the tissues that don't get great blood supply with 100% oxygen saturation that lasts, you know, the oxygen tension will last 6 to 8 hours at 100% oxygenation. And so now it's killing that off. So it's pretty cool to be able to see that without using an antibiotic, and also all the other health benefits that you get, because you get neuroregeneration or neuroplasticity. You start to create more brain cells and things of that nature, which is where there's preliminary studies that have been shown with Alzheimer's disease, or let's say it's a vascular dementia, or they have Parkinson's disease, that there are things that people can be helped with neurodegenerative disease to traumatic brain injury. And with TBI, I've even had a person with suicidal depression that after the 6th treatment, they literally came up and gave a hug and said, "This has changed my life." So
Wow.
when you see people at that level, and again, that's because there's certain areas of the brain that can get shut down and you get decreased blood flow. You see them on SPECT scans. People can look up David Amen. He's got multiple studies of before and after. So there's no question whether or not it works. It's just, how do you package that up in a pill? You don't. It takes time. It's a commitment, but you're regenerating your body at the cellular level that's going to help your body in a multitude of aspects as opposed to one singular thing. Because there's no prescription drug out there that's going to make you healthy. It's always inhibiting something, but it can decrease that load. So don't get me wrong. So if someone is septic, I'm sending them to the ICU. They're going to get IV antibiotics, decrease that aspect because they got this massive infection in their bloodstream. But when they're done, then we play handyman. And that's when we go into with a different set of tools to help their body regain its resiliency. Why did they get so bad? Why did they get to that point? What was the precipitating factor? So,
Yes. I love everything that you just talked about. And I think talking about it in a way of like stages, because I think a lot of people ask, well, like, what do I do for this condition? What do I do for Lyme? And it's like, that's a very complicated
yeah.
answer because it depends on where your body is at. And I love the hyperbaric approach for things like spirochetes and different infections, because then it can also affect the cyst form, which antibiotics can miss.
Yep.
And so then you start to get like that secondary Lyme where people like take antibiotics and their Lyme is cleared, and then all of a sudden it comes raging back. And so it's like, this is a way to take care of the form that goes into hiding. And it's all such interesting concepts and how it affects things like mitochondrial health. And then I know like you've also talked about how like this and EBU can affect mitochondrial health and the cell danger response. I'd love if you could talk a little bit about the mechanism around that.
Yeah. So the cell danger response is basically our body's cellular response to adapt to the environment. And as I alluded to in the beginning, from the physical, chemical, emotional aspects, we can have a cell danger response. So let's say all of a sudden I am exposed to black mold and I'm getting tons of mold toxins into my body. My body recognizes that. Your mitochondria actually are censoring organelles inside your cells that not only make ATP, but also will stimulate other cascade of events in the body. And so that is either energy, preservation. So we're going to stop making energy because when our body is encountering something, it will also send out signals to create inflammation. So in an acute setting, our cell danger response is great. I come across an infection. My body is going to shut down other aspects. I mean, how many people have tons of energy when you're sick? You don't, right? Because the immune system is very energy dependent. But the body's taking all those resources and putting it towards the immune system to fight whatever infection you have in that time, which is why we're laid up, we're resting, taking it easy. And so the body will shut down. You actually will check people's what's called reverse T3, and you'll see we don't even check it in thyroids in the ICU because they'll be hypothyroid. Why? Because the body is slowing down your metabolism elsewhere because the immune system needs all your energy. The problem becomes in the cell danger response is when we have this chronic stimulation of environmental damage. And again, that can come from the foods that you're eating to having a sedentary lifestyle and having a toxicity of being a sloth, to negative mindset, because that will change all the way down at the cellular level. We know, you mentioned earlier about epigenetics, and we know that babies in utero will have more of a fight or flight response, more of a sympathetic dominant, I'm getting chased by a bear reaction, to a mother that was battered when the baby was in utero. And that they'll be more hyper vigilant and more jumpy, and be more in an adrenal stress state. And so we know, and it changes their genes, and it'll turn on some of those genes for a baby that's in utero that wasn't even in that external environment truly like it was for the mother at that time. In the same way that animals will do it, where cows will stop reproduction and not produce if there's a drought or they're exposed to a famine. Whatever, our body adapts to that environment, but it's the chronicity of it that ultimately will start to deplete our energy reserves. And then that's when the cell danger response truly becomes an issue, is because it's constantly turned on. We haven't removed ourselves out of the environment, or we're not setting ourselves up to overcome that environment. So our body is just constantly adapting. It's a yin or yang. It's back and forth. It's a constant dynamic balance. And so there are two terms when it comes to cell danger response that I think is important to understand. Most people have heard the term homeostasis, which is stability through consistency. Most people have a normal body temperature. We used to say 98.6 till everybody started checking their temperatures a couple of years ago, and we actually learned it's a little bit lower. at like 97.6. Somewhere around there. It was definitely a different set point than what we remembered. And so there's a little bit of drop, but it's pretty consistent in most cases. However, people think that blood pressure 120/80 is homeostasis, but we actually spend more time out of 120/80 than we do in it. Again, if you are emotional and you're crying, your blood pressure goes up, your heart rate goes up. You have fear, your blood pressure goes up, your heart rate goes up. I hit my thumb with a hammer. Guess what? I got a pain response. My blood pressure is going to go up. My heart rate's going to go up. I'm not sick. My body's adapting to that physical stressor. And when you sleep, your blood pressure actually drops, typically when you sleep. And so there's not this constant level. It's constantly fluctuating. So to treat just a number doesn't make sense, but the body is very energy conscious. So it really wants to not waste energy. So if you're constantly in a state of fight or flight, then guess what? They've done studies, and this is what we call allostasis, which is stability through change. So again, my body is adapting to my stressful environment, but if you don't get out of that environment, guess what? You still have that stress response. So the body will start to look at it, and blood pressures will consistently be high because now you just have vasoconstriction, or the wall of the blood vessel starts to narrow because the inner lining the smooth muscle gets thicker and thicker. Well, then that is a way for the body, or you'll lose the elasticity and they become more firm. So if you increase the resistance through narrowing a tube or lengthening the tube, the body's going to adapt and it will make it that way. So then the blood pressure will consistently be high because it's like, why do I keep wasting energy to contract, relax, contract, relax, contract, relax? I'm just going to contract and stay there. So, hey, why don't we just lay down smooth muscle, make the tube more narrow, which is going to increase the resistance and keep the blood pressure up. So it's, again, that's allostasis. So our allostatic load is all the things in our environment. And when we get overloaded, negative thoughts, poor diet, not exercising, because our body it's meant to move. And it's like a car. If you park it in a garage, it's going to break down. It's made to run. And most cars, even though these days it's changing, but the analogy is a car is made to run off of gasoline. You don't put Coca-Cola Classic down the gas tank. Our bodies aren't made to run off of ding dongs and ho-hos and Twinkies and pizza all day long and Coca-Cola Classic. And no, I understand that Coke may have purified water, but it's not the same as drinking just water, right? So now you've got this onslaught of high caloric, nutrient deficient intake into your body that your cells are made to run off of vitamins, minerals, proteins, fats, carbohydrates, and water, and oxygen. And without those at any level, your body's going to start adapting, trying to find a way. But then that's when symptoms start to manifest, is when you become deficient. And then it's finding, where are people deficient? Where are they toxic? And all those aspects. And so my background really gives me that ability to meet people where they are in that spectrum, to identify, am I playing fireman or am I playing handyman? And then, or do I start at fireman and go back to handyman and get them towards health and wellness as we continue to age, but age in a different manner. And it's pretty cool to see the changes that we see here every day. And I act as a professor for third-year med students. So it's really cool for them to be able to see the changes in the office of the follow-up visits of what can happen in 90 days, just to see their labs change. People don't have high cholesterol because of Lipitor deficiency. There's a reason for it. People aren't depressed because they don't have enough Zoloft. Now, don't get me wrong. There's a time and place that these medications are useful and beneficial. I'm not going to argue that. But for the general person, that it's a lifestyle situation and we're just medicating a poor lifestyle, you can't out-medicate yourself out of a poor lifestyle or poor environments. You have to find what's causing the problem in the environment, whatever that may be, on all facets, and that will allow the body to get back towards less allostatic load, less adaptability, more towards a homeostasis and stability through consistency.
Well, and I think I love that you're bringing up allostatic load. I think it's a incredibly important concept because people often try to search for like the thing that made them sick. And it's just not really the way that it works. It's usually like an accumulation of stuff. And then there's this cycle that we get caught in where it's like, let's say that you go through something traumatic and emotional and it actually starts to like change your gut biome and give you leaky gut because you have bacteria in your gut that actually respond to your stress hormones, and you can grow dysbiotic bacteria and accidentally produce more toxins on the inside of you and then get it into your bloodstream, and then it starts to affect your brain. And I've actually been through Dr. Daniel Amen's brain health coaching certification program and looked at a ton of SPECT scans, and there's a specific pattern that you can see in the brain where the oxygenation changes that is associated with things like infection, and then you become less emotionally resilient, and then something else stressful happens, and then it feels more traumatic because you're less resilient, and then we get caught in this like ugly cycle. And I know that you've done so much research around gut health and things as well, and how that affects the brain and this whole system. And this is why I really enjoy talking to you, is it's like not all practitioners look at things quite as holistically. And I'm so on board with the way that you think, where it's like even bringing in components of like our energetics and what our mindset is doing for things like our energetics or kind of like our spiritual health, that component, and how that even affects things like our gut health and how it goes back and forth. So I love, like, I know you're working with Humarian, which is a company, I believe you guys even produced like a really cool probiotic. I think you told me when we met at a conference that someone had used that probiotic and ended up helping them clear C. diff.
Yeah.
And there's so many cool things like that. So I'd love if you could talk a little bit about the work that you guys are doing with the gut, and then how that ties into the brain and the other stuff we've been talking about.
Yeah, great, thank you. So when it comes to, so Humarian is a company that I am part owner in. Before I even went into medicine, I was starting on this project. I was asked if I would consider being part of this organization. They had some proprietary processing. And I was like, well, if you put your money where your mouth is and I can prove what we know to be true or what we believe to be true, I have to actually see it, not just because of hearsay. I have to do that. And so we have our product was the very first liquid probiotic. The difference was I actually, prior to that, I had quit recommending probiotics because our first line of defense is stomach acid. So you swallow a capsule that's not encapsulated, there's no time release or anything, most of it's going to kill off. So that's where it became a game of who could put more in, hoping that 1% to 2% might survive the gut. And so I really got away from recommending them. This is like 2007, 2008-ish. And then around 2010, I was first approached by this, and then really got into it after about 2 years of studying and researching and interviewing and meeting people from around the country, actually around the world, to really peruse this and look at that. And so it was the first liquid probiotic. And what it does is you think about a bear hibernating. So these are viable but not culturable bacteria because they're in a hibernated state. It's what we call the lag phase of bacterial cell growth. But we get them in this stagnant phase where they're metabolically active like a bear hibernating, but they're not growing, they're not replicating, they're not doing anything at that point, which is why it doesn't need to be refrigerated. It's the only thing that's got prebiotic, probiotic, and postbiotic. And so it's a 12 strain blend of probiotics that take care of the majority of things that people encounter. And it will put those into this lag phase, and then it gets into the small intestine, and then along that path, some of them will get dumped off. Yes, there are probiotics in the small intestine. People used to think that it wasn't; it was only in the large intestine. But there are certain ones that get dropped off along the way, and then they get into the spots to do the good that they're meant to do, and then that's when they become activated. And so we were able to show 10 times survivability, better than the leading probiotic, compared to at that time the leading physician brand. And so 10 times the amount. And not only that, as the transient time going through the intestines, it would check it at the end, and there was an exponential growth over 300 minutes of time as it's going through the intestinal tract of the survivability and going through, compared to where the other one's just declining. This continues to increase the percentages that are staying alive as it's going through, because bile acids can kill bacteria in the gut. Your stomach acid can kill it as well. And then other bacteria edge out other bacteria. So the microbiome, I mean, there's over 800 different species of bacteria in our gut. And we are just in the infancy of understanding all the complexities. We've got terms like psychobiotics, meaning that there's certain bacteria that we know trigger depression, that are linked to neurodegenerative disease like Parkinson's. And Campylobacter jejuni leads to ascending paralysis in people. And so it can, let me restate that, it can lead to that. And that's a known thing that we know. So it really helps us to, I felt confident that I can give a probiotic that is able to actually survive and do the good that it's meant to do. And then the prebiotic helps feed your other bacteria and microbiome. And then you got that 12 strain probiotic. And then the postbiotic are the metabolites. And so when you go back to some of the studies early on with regards to probiotics, you know they're dying off, but then why were people getting benefit? Why were we able to see these things? And it's because the postbiotics, it's what I call bacterial cell lysate. So think of a grape that gets squished, it releases its contents. And in there, you got cellular messengers, biomodulators. And so that's why you could have the dead bacteria that can still create benefit. But we know that if someone is eating a high carbohydrate food all the time, they're going to feed certain population of bacteria that are going to make them feel more bloated. Yeast specifically, yeast is part of our normal flora. It's usually kept in check, kind of like spiders keep the insect population. Sorry, honey, my wife does not like spiders, and I just use the term spiders. So the little 8-legged things keep the insect population under control. Hunters keep deer population under control, whatever. I'm in the Midwest. We do a lot of deer hunting. I don't, but other people do. So when you look at that, the same thing, probiotics keep yeast under check. But when you take antibiotics, it's why people usually get a yeast infection or can get a yeast infection because you wiped out a lot of the probiotics and that were keeping the yeast in check. But again, there's so much information coming out daily on probiotics. But Humarian, we have Probonics. That's the name of the product. It's called Probonics. It's a liquid probiotic, doesn't need, refrigeration or anything like that. Pretty cool product, but we are just launching. So we talked about allostatic load. So the gastrointestinal system from the mouth down to the rectum is our digestive system. So I get excited about this because I think the oral health is a gateway to our overall health. I worked in a city that our clinic, I worked with a lot of people that were homeless, lived at the Mission, weren't in charge of their food, but the food that they did have were usually highly processed stuff that has a shelf life. That's not really good, healthy food. But when they don't have teeth, how are they going to grind up their salad or their meat and get the raw nutrients from that, the micronutrients, your B vitamins and things of that nature? They're not going to. And so you got to start with teeth. And so we have a product called IGY. This product is called Smile Guard, just launching. But IGY technology is using egg antibodies. So we inoculate a chicken with whatever thing we're making in our proprietary process, whatever we're making it against. And so with the teeth, strep mutans creates dental decay and cavities. And then P. gingivalis causes leaky gums. People are familiar, probably that are on your channel, are familiar with leaky gut. There's leaky gums as well. And so Porphyromonas gingivalis is a bacteria that will bind to your odontoid ligament that will destroy that. And then you start to get gum recession, bleeding on probing, inflammation in there. And then that bacteria now gets into your bloodstream, creating chronic infection. So we have a product that is pretty phenomenal that is a passive immunity. So some people are familiar with breastfeeding. We breastfeed because the baby really can't make great antibody production up until about 6 months. So the mom makes antibodies and it comes out in the breast milk. And the baby, when it gets the milk, it will bind things in the gastrointestinal tract, neutralizes it, and carries it out of the system. It binds to it like a magnet. The same concept, we use eggs because egg antibodies, IgY, have a better binding ability than IgG in our own blood. Binds tighter like a magnet. And so it will actually go in there, bind to it like a magnet, and then neutralize it, and then it'll fall off your teeth. So strep mutans is no longer on your teeth, binding and creating this film that you feel after you have sugary beverages, and then it creates this acid that eats away your enamel, and then you get cavities. It also will bind to the P. gingivalis and decrease the damage to the gum lines that start to occur there. And so, but it doesn't activate your immune system. It just decreases the allostatic load, the load of the bacteria, to give your body a better chance. And then you couple that with a probiotic, creating a healthy oral environment and eating the foods that your body needs. Now you're starting to work from digestion. One of the things I think about when digestion is people don't chew their food good enough. They're in a constant stress mode. They're eating while they're driving, going to their next event, and the food that they're eating usually isn't really healthy, and they're not chewing it well. So I tell people to try to liquefy your solids and chew your liquids. So you put a beverage in your mouth, kind of swish it around so it mixes with your saliva and starts to help break down because you release amylase in there. And people, if you don't chew your food, what people don't realize is your saliva, you release what's called R binder, which you chew down your food, you break it down. Now, R binder binds to B12. B12 will therefore, you swallow it, it goes into your stomach. Without the R binder, it's not protected, and B12 will get destroyed. So now you have to go down into your stomach, it binds there, and then the stomach acid will unbind the R binder. When stomach acid is released, the body releases intrinsic factor. Then it goes into the small intestine, intrinsic factor binds to the B12, and then it gets pulled in at the distal ileum of the small intestine, which is the last part. So it's a very intricate part, but if you don't chew your food, you can't get B12 in. If you don't have saliva production because you're taking a medication that dries up your saliva, or you have an autoimmune condition called Sjögren's syndrome, that might affect it. Or you're just not chewing it food and you're not mixing it with your saliva, you're not going to get the R binder. Or you're taking a proton pump inhibitor that's inhibiting your stomach acid production, and now you're not going to get the intrinsic factor release. So you see how it's all a cascade, it's all connected? Well, guess what? If you don't have B12, you can't make your neurotransmitters effectively, so you can't make your serotonin and all the biochemicals that in the neurotransmitters that make people feel good. And serotonin gets converted to melatonin. You need B6 for that. But if you're constantly stressed, you don't convert your serotonin to melatonin because your cortisol is inhibiting that process, and it's this big feedback loop. So it all, but again, it all comes down to, let's start with the basics. Let's work at the level of cell, bring your level of resiliency up, find out what are the stressors that are coming in, whether it's what you're putting into your mouth, into your mind, in your environment. Maybe you got mold in your house and you don't know it, or you're in an abusive relationship. I mean, you have to identify what all these stressors are to remove those as you start to rebuild, because there's no point in putting someone through a detoxification for mold toxicity if they don't remove themselves out of the environment or fix the water leak that's creating it. You're just going to be a cat chasing its tail. And you can't out medicate yourself out of a poor environment, and you can't out supplement yourself either. So someone on 42 supplements doesn't make sense to me. Your supplements are meant to supplement your diet, what you put into your mouth, and fix in and backfill the issues. Some people can't absorb because they got pernicious anemia, or they've got celiac disease and they can't absorb their iron, or whatever. But supplements are meant to supplement. They're not a lifestyle. It's fix the lifestyle and the environment first on a physical, chemical, emotional level, and then you backfill and help build that resiliency up. Because if people are B12 deficient, well, why would I want to put someone B12 deficient that I know helps build neurons, and you don't have B12? Why would I throw them in a hyperbaric oxygen, telling the body to make more neurons, but we don't have their raw material there? That's like go build a house without 2x4s. It's not nonsensical, right? So that's where you just have to be diligent and comprehensive in looking at the body in this whole spectrum. And people don't have to have 3 doctor degrees to do this. This is all information that is in our basic physiology. My med students, when they come in, oftentimes they're like, oh yeah, they told me after second year, forget everything you just learned. It's all clinical. And I said, no, you master the basics. You seldom need anything else, because you could troubleshoot yourself through every problem going through physiology. That's why I loved working in the ICU. The ICU was phenomenal because it was all physiology. Most of the time the patient's unconscious, and to be able to just watch the physiology and make changes, use certain medications that I know are working specifically at one cellular function. But you just can't take one gear out of a watch and expect the whole thing to work continuously, right? But we can use it in the acute situation. Again, that's where you're playing fireman. So where people have this misnomer when it comes to medicine isn't really built to be, the whole paradigm is not built to be the handyman in most cases. Our training is to keep people alive, and then we've taken that same model of medicine and applied it to chronic disease, and it doesn't work. That's why people end up on one medication, on another, and another, and they're no healthier for it. They're worse off. But again, don't get me wrong, there's a time and place for this medication. We just have to be able to know what's our end game. Let's stabilize you. Let's stabilize you. Let's do what we know. And then let's figure out the cause, because you didn't have this problem when you were 20. What was it in that timeline? What created this? So that's, people say the medical system is broken. It's not broken. It runs exactly the way it was designed to run. It's just we're applying it to the wrong model, and that's chronic disease, which is mainly lifestyle. And so again, and that lifestyle isn't, oh, I'm just eating poorly. you have to look at all the environment, the physical, chemical, emotional stressors.
Yep. You just said so many amazing things. And with the physical, mental, chemical, that's the same way that I look at things. And that's, like, and in the chiropractic realm, that's basically like the triad that everything's kind of founded on, is like, these are the stressors that affect our body. If we can balance them, then our body is designed to come back to a state of balance. But sometimes we need help. And I think one of the biggest things that we haven't quite dove into yet, but I think is probably the most important component of health, in my opinion, is where your mind is at and what you're doing with your energy and your body. Because if your mind is in a state of defensiveness and fear, then your cells and your immune system is going to be in a state of defensiveness and fear. Like, your mind, your energy directs your physiology. And I also really love that how you commented on, like, foundational physiology is truly the key to health. And I work really similarly in my own practice, where it's like I focus on cellular health. And if we can get the cells operating correctly, then usually the body will be able to come back online. But I'll also find, like, sometimes people will over supplement. And if you're in a state where your body, like, is in such a cellular danger response that you can't even absorb nutrients, then if you're also fighting an infection and you put a bunch of supplements through the liver, you're not taking the liver's capacity to process stuff and putting it into the supplements versus allowing it to process the infection. So there's this balance that you have to hit. Like, more isn't always better. And I talk to parents about this and stuff, because sometimes they'll give vitamins to their kids, which is awesome, but kids are incredibly resilient. And if you are giving them vitamins, they need a completely different dose than you, because they're smaller and their body processes things differently. And so just like helping people to understand the concept of allostatic load, and why care plans need to be catered to each individual person and where their body is at and what it's doing and what their physiology is doing. And sometimes you have to change things, and sometimes you don't take supplements every single day. And sometimes you might take a different supplement if you're stressed out versus a different supplement if you got hit with a chemical exposure. But the mental stress component, like, I'll loop it back to like how it affects the gut and different things. It can even affect your hemoglobin A1C. Like, if we're super stressed out, it can affect, basically, like, another way to say it is almost like the rust on your cells, right?
Yeah.
So stress can actually affect these things. And this all leads back to kind of our energetic health, our emotional health, our spiritual health, and all of this affects the body. So what has your experience been in your practice of kind of helping people to better understand how they're directing their own energy, how this connects them to their own, like, spiritual health in that triad, and then how that affects everything downstream and the chemical and physical components of health?
Yeah. So the mental aspect is the hugest component that you have. And I think people have to move from a state of motivation to inspiration. And motivation, I look at that as it's self-centered things. I want a six-pack abs for spring break. I want to look good in blah, blah, blah. I got a wedding coming up, whatever it is. We'll fail ourselves every time. And I don't know if that comes back to a essence of shame and worthiness, that we don't feel worthy, that we feel unworthy of the gift that we've been given with this body and this time that we have here on earth. So when you switch your mindset to something that's more inspirational, it's something bigger than yourself, that you are serving something greater. So what is it that gets you out of bed in the morning? What gets you out? What gets you to do these interviews, to share with your people that you have an influence on? That's part of your driving force, but you've got to be healthy to do that. I can't come into my exam room and go meet somebody for the first time 300 pounds overweight because I'm eating trash and not practicing what I preach, right? So it comes back to, for people to realize that you are worthy, that you do have gifts and skills that can influence other people, and those people are dependent upon you. And you may not even know what that is yet, because you haven't taken the time, and people haven't found their sense of worthiness and their self-love of who they are as a person, and accepting that and embracing that. They've been told by whether it's people have told them that you're never going to amount to things, and they've got past traumas or whatever. They need to move forward and move beyond that, and not be stuck in the past, because living in the past is just going to lead to depression. Living in the future leads to anxiety. Live in the present, focus on the now. And really, in that aspect, think about the people you have influence. And I had one person say, well, I don't have influence over anybody. I said, who takes care of your 7 cats if you die tomorrow? Well, I love my cats. I don't. Okay, well, that's your why. That's your why. Your why is loving on those kittens and caring for them. Whatever that is. And because they told me they didn't have any family, they have nothing. And well, that's all I heard was about her cats. So again, that's her why, you know, and that's what people need to get back to is in their mindset. They need to have that mind flip of it's not about you. It's about serving others, loving people and exuberating them. It's a lot easier to do it if you have the energy and the capacity to do it. I believe anybody can be used at any state that they're in. It's just about how more useful can you be? And that's the key. So with that, you got to think beyond yourself. And if you look at even AA, you know, Alcoholics Anonymous, it's the best treatment that we have out there for alcoholism. And it's only 10% effective. But it's all about a higher power. It's all about something bigger than yourself. It's about letting go of grievances and giving forgiveness. Forgiveness is really more about yourself. I mean, and moving forward there. But anyways, I mean, and if you think about, as you mentioned, like with the microbiome, if you're getting chased by a bear, guess what? You're not going to stop and have a meal because you're going to be that bear's meal. You're not going to stop and take a dump, right? You're not going to have a bowel movement, right? Because you're going to be that bear's meal. There is one part of physiology. Some people are like, oh, when I get scared, I pee my pants or I defecate or something like that. Well, that is honestly that stress response because the body is at the very end and the body says, hey, we need to unload my weight so then I can go run. And so that's why it's part of that stress response. But the rest of the digestive system shuts down. So guess what? You're not processing your food. So we mentioned earlier about the moms and kids that are driving around in the minivans going from one thing to another and eating their food in the car and not chewing it. And it's not really all that nutritious anyways, but they're in a stress state. Just driving, they're in a stress state. So you think about a lot of these people with longevity and the centenarians, a lot of it has to deal with purpose, community, taking your time when you eat, and being mindful of those things instead of just mindfully just eating and not and just processing just to go get that next check mark of my day. You know what I mean? So and then if you're in this constant state of stress, your body is not going, and those stressors again aren't just physical and chemical, they're emotional, as we've talked about. And we mentioned earlier, fear by itself can create this whole cascade of events in the body. Sometimes people are so paralyzed with fear that they can't move forward, and it's affecting their body overall. You mentioned earlier about blood sugar and stress. Stress levels release cortisol. Cortisol is a stress hormone, is a glucocorticoid. For glucose, it's a glucose releasing steroid. So what does that do? I've had people that are basically essentially type 2 diabetic due to their level of stress. You look at Cushing's syndrome. So we talk about cortisol and Cushing's syndrome. People get the moon face, the red rosy cheeks, the buffalo hump, the central pedal obesity. They're eating right, they're exercising, but they're over exercising because they're doing a HIIT workout because they think they should be, but it's driving their sympathetic dominance even higher, making the situation even worse. And those are the people that are working out going, I gained 10 pounds. I'm working out every day and I gained 10 pounds, but I'm eating great. And that's where you have to look at this. It's not people are people. People aren't protocols. And that's the difference. And this is where there's this divergence of traditional medicine. It's very cookbook of you got this, you give this, you got this, you get this. And it's beautiful in a lot of cases. And you can do things protocol based and encompass a good 60, 70% of people. But it stinks when you're in that 40 to 30%, whatever that is. And if you or your loved ones in that state and suffering, and that's a key difference as well. But again, all this information is in the textbooks. It's in the research articles. This isn't some hocus pocus, crunchy granola mindset. This is physiology, and this is how our body works. And again, as I mentioned in the very beginning, it's years of dysfunction that lead to disease and pathology on a physical, chemical, emotional level. And again, the emotions are huge. You got to be right in your mind because you got to know why you want to do this. New Year's resolutions they're all gone pretty quickly, right? Because they're self-centered, self-motivated type things, as opposed to doing it for something bigger than yourself and leaving a legacy behind.
Yep. And I've seen so many interesting things with like running group programs. Like I had a patient who was having a really difficult time and she actually made more improvement in the group program than in our one-to-one care. And, you know, it's been a journey. Like healing is a journey. We go in and out, we get to a good place. And then and then all of a sudden, like, we have to do something again. I teach people, like, your gut biome is kind of like a rainforest that we maintain. Like, sometimes you need to mow the grass, and then you like re-inoculate with a different seed, and then you have to do that again later, especially after like an injury or a stressful event. And it becomes this lifestyle that we maintain, and that goes the same for your spiritual health. And I kind of, talk about the mind, and like, we have to avoid our bladder, we have to avoid our bowel to avoid our body of toxic waste. Sometimes we also have to take time to avoid the mind of toxic thoughts. And that can be meditation, that can be prayer, that can be jogging, that can be movement, that can be a whole bunch of different things. But it's allowing, a simple way that I like to say it is, it's allowing your body a time to feel safe and to enter a rebuilding state and a creative state. And that can come in a lot of different forms. And it's more about finding what resonates with you, and maybe trying like a couple different types, because they all have different effects. They are their own medicine. And it is amazing what can be done. And it's being shown in tons and tons of research. Like, people are completely changing their microbiome from meditating for a week with doing no other lifestyle changes at all. And it affects your blood sugar, it affects your blood pressure, it affects your hormones and your neurotransmitters and all of those things. So that is why I couldn't agree with you more, that I think it really is like the most important foundation. Because if we come back to that whole cellular danger response thing, I can give somebody all the nutrition in the world, and they can do all the hyperbaric chambers and biohacking and all the things. But if their cells can't exit a cellular danger response because their brain is living in a state of fear, it's not going to matter, because their body
Right.
can't integrate it. And so sometimes I'll start with body work with people. And I had another gal who just like went through some challenging things, just like life events, right? And then she was just feeling really off in her system, and it was kind of more her nervous system. So this is where I love like chiropractic or body work or things like that, is sometimes you need help to exit that fear response, that danger response. Sometimes you actually need like human contact for it. And there's physical modalities that you can do to help the nervous system shift out of state. And then that person can start implementing more meditation and different things like that. So anyway, I'm sure we could talk about that for much longer, but I want to make sure to honor your time. Thank you so much for taking the time to talk about this stuff today. It was awesome. For anyone that was asking questions, I might have had a little tech mishap, so I apologize if I didn't see them, but go ahead and comment on this video after we post it, and we'll be happy to come back and answer some of your questions, because there was a lot of great topics at this. And if you wanted to tell people anything, or there was something that you wanted them to know, or they wanted to work with you or learn more about you, what would you end with?
I guess the biggest thing is, if people want to connect with me, BentleyMD.com is my place that everything is going. You can connect to Humarian there. You can put in your email, and I have a whole back end system of education that will be coming out, walking people through it. I'll have it for providers, understanding blood work and different other testing and what leads to that, and going in depth. Because again, if I die tomorrow, all this knowledge that I've assimilated over time is all for naught, because it goes with me. And so that's my effort to leave a legacy. If they're interested in my new book, the other two I will be doing revisions. Sex, Lies, and Cholesterol is way outdated. It needs lots of information. But that was my first go at a book that I never thought I'd ever write a book anyways. But Vessels That Thrive, there's some stories and stuff I would integrate. But if people want to connect with me, they can opt in there at BentleyMD.com, share their email, and then we'll start reaching out as things start to continue to progress. Because as I've said, it's just kind of me now coming out of the woodwork. I used to do all these things, 12 years ago, and then I deleted everything because I wanted to just master medicine. I couldn't have any of this other life. I needed to just go in, immerse myself so I can master what I was being taught and move forward. And then I figure out on the back end how to integrate. And now we have our practice and where we are. And now it's how do I go out there and have a bigger influence on people to help them maintain health. Because again, no matter what I do, I have a finite amount of people I can see in a day.
Yeah.
But if people can continue to learn and they like what I have, I would say go to BentleyMD.com. And that health and wellness is a journey, not a destination. So hang in there. You are worthy. You are important. You have a circle of influence, and you should love people and care on them. And I just want people to value themselves and what they have to offer the world in the timeline that we have here. And that's the most important thing. And we could do it in a more healthful manner, even better, because you could have it a bigger impact in that way as you have more energy to influence even more.
Absolutely. Could not agree more. Thank you so much for all of your thoughts and all of your wisdom. And yeah, for anyone who wants to learn more, definitely take a visit. You can also just click his name in the live here and go visit his profile. And yeah, there's a reason I brought him on. So definitely check out his stuff. And just thank you so much for taking the time today. And I hope you have a wonderful rest of your day.
Well, thank you. And thank you for all you do. And I appreciate having me on.
Yeah, absolutely. Talk soon.
Thanks. Take care.